No, exactly. And so we talked about medicinals and how we can get people off medication. So if they want to have certain foods, how can they use food as medicine and try to improve their nitric oxide? You mentioned about the variation in nitric oxide levels in different vegetables. But what foods that can people try to eat that can help out with this?
Well, it's really the plant-based diet. I mean, I had a number of conversations with Caldwell Esselstyn, Joel Kahn, cardiologist up in Michigan, and the data on plant-based diet completely reversing cardiovascular disease and ischemic heart disease is pretty impressive. So, but here's the challenge. It's as we published in 2015, it's difficult, if not impossible, to know if you're getting enough nitrate from the vegetables you're eating. But let's speak kind of globally. The darker the green leafy vegetable typically has the higher nitrate content. And so the more dark green leafy vegetables typically contain more nitrate. But these vegetables will only provide a cardioprotective benefit if you have the right oral microbiome. So you could eat a plant-based diet, all green leafy vegetables, but if you're using mouthwash or have fluoride in your toothpaste, you're not going to get the nitric oxide benefits of that diet because you're killing the microbiome that's responsible for activating the nitrate in that food into a bioavailable source of nitrite or nitric oxide.
How much nitric oxide or how much nitrates we need to ingest on a daily basis, and how much is the U.S. population actually getting it? If you have any numbers on this, and what is possible through just diet alone? Is it possible to correct your nitric oxide levels with just diet alone? Is that a possibility?
Absolutely. Look, in a perfect world, that's what we should do. We should let food be our medicine and medicine be our food. So if you look at the published literature, and these have been well validated now for the past 10 or 12 years, to reach the threshold of nitric oxide production, you need at least 300 to 400 milligrams of nitrate in a single serving, in a single meal. So that would equate on average to about 150 grams of spinach or kale or arugula, which is a big plate. And that's hard for people to consume in one serving. But we looked at the standard American diet, and the typical American diet, we're only getting about 150 milligrams of nitrate per day. And that's over 2 to 3 meals. So the standard American diet is completely devoid of any nitrate. And so you can far exceed that. So for instance, in our 2009 paper in the American Journal of Clinical Nutrition, people following the dietary approach to stop hypertension can sometimes get 1,200, 1,500 milligrams of nitrate per day, depending upon which foods they eat, how they're grown, where they're grown, and the nitrate content. So to answer your question, yes, you can completely restore your nitric oxide production simply through diet and lifestyle. But you have to eat the right foods. You have to have the right oral microbiome. You have to have a functional NOS that can be activated and stimulated through exercise. And if you do that, it's diet and exercise that we've known for centuries that prevents chronic disease. And mechanistically, we can explain that through the production of nitric oxide.
What are the early signs of possible low nitric oxide levels and deficiency? Are there any particular signs that you look for or you have noticed?
Yeah, there's actually a hierarchy of clinical symptoms that manifest. The first one is erectile dysfunction, because if you can't produce nitric oxide in the blood vessels of the sex organs, you can't get dilation, you don't get engorgement, and you develop sexual dysfunction. And that's in both men and women. It's not just a male disease. So that's usually, and it's called the canary in the coal mine for the reason. If you have vascular dysfunction in the sex organs, you have that same vascular dysfunction in the coronary arteries, in the cerebral arteries, in the blood vessels that supply your liver, lungs, kidneys. So it's a systemic disease that manifests first in sex organs because you need a rapid dilation upon stimulation to get and maintain an erection sufficient for penetration or intercourse. And then if women can't make nitric oxide, they become anorgasmic. Because in order for women to have an orgasm, you have to have an increase in pressure in the clitoris and the labia, and that pressure comes from an increase in volume, from an increase in blood flow, from an increase in nitric oxide production. So if the blood vessels can't make nitric oxide, you don't get dilation, you don't get an increase in volume, you don't get an increase in pressure, and you cannot have an orgasm. And then the second one is usually an unsafe elevation in blood pressure. If you lose the molecule that's responsible for vasodilation, blood vessels become chronically constricted and contracted, and you develop high blood pressure. And 2 out of 3 Americans have an unsafe elevation in blood pressure.
All right, so there's one erectile dysfunction that happens due to atherosclerosis or tightening of your blood vessels and plaque that can go in your heart, your brain, and in your reproductive areas. So, but some individuals, if they take testosterone, for example, in men, they may they may get back their mojo, perhaps. Or individuals who are getting into their 40s with the low testosterone levels, when they start getting on TRT, they may get erections, much like when they were possibly even teenagers.
Right.
And then I'm going to throw something else in there, sildenafil, or and these similar medications, Cialis. So how do these help out? And I do know that these medications they're not effective 100% of the times. But given that we're talking about nitric oxide, but we are able to utilize other means to get, for example, in men, erections, how does this fit into the picture?
Yeah. Well, testosterone and estrogen in both men and women stimulate and activate nitric oxide production. So if you have low testosterone, you have less activation of the NOS enzyme. So it's kind of like if you lose it or use it or lose it, right? And then the PD5, so if you restore hormone replacement, then you're going to get better activation of nitric oxide, and in some cases, you get better erections. But in terms of the PD5 inhibitors, the tadalafil and the sildenafil, those are called phosphodiesterase inhibitors. So as we talked about when we first started talking, nitric oxide activates an enzyme called guanylyl cyclase. That enzyme converts GTP, or guanosine triphosphate, into cyclic GMP. And it's cyclic GMP that's broken down by phosphodiesterase enzymes. So when you have a phosphodiesterase inhibitor, you prevent the breakdown of cyclic GMP. And it's cyclic GMP that's responsible for smooth muscle relaxation and blood vessel dilation. So nitric oxide turns the switch on, the PD5 inhibitors keep it on. And that's the reason you're warned against 4-hour erection, an unsafe drop in blood pressure, and all the side effects that come along with those drugs. But you also make a very important point. These drugs have been on the market now for 25 years. And clinically, 50% of the men that are prescribed these drugs don't respond. 50%. And so mechanistically, we know why that is, because you need some level of nitric oxide being produced to activate soluble guanylate cyclase to produce cyclic GMP. So in patients that are non-responsive to PD5 inhibition therapy, their blood vessels aren't making enough nitric oxide to lead to any appreciable accumulation of cyclic GMP. So there's nothing to prevent the breakdown of. So PD5 inhibitors cannot and will not work. So that's the reason that men become non-responsive. So now we know that if we can stimulate nitric oxide production or give nitric oxide through our lozenge or some other technology, that we can activate guanylate cyclase, we can improve cyclic GMP production, and now we can improve erections through PD5 inhibition therapy.
A couple of things that we got clear today, but one question that still lingers, and a lot of people. So these similar symptoms that we have talked about, people say, okay, you go on the vegan diet, or you go on the ketogenic diet, or you go on, you do intermittent fasting, you take testosterone, these symptoms go away. Is there a commonality? You just mentioned about testosterone, and you also mentioned, the vegan diet could be healthier. Is there a commonality with all of this? And you can throw in the paleo diet into the mix. Is there a commonality how these all combine and work together?
Yeah, there is, because the hallmarks of all chronic disease, there's 4 things that occur in all chronic disease. There's low blood flow, what we call hypoxia or focal ischemia. And then concomitant with that is inflammation, oxidative stress, and immune dysfunction. And all of those lead to a decrease in nitric oxide production, which further exacerbates the inflammation, oxidative stress, and immune dysfunction. So when we start to change our diet and lifestyle, if we can inhibit the inflammatory response and limit the amount of oxidative stress that's occurring, then we can prevent oxidation of BH4, which causes NOS uncoupling and endothelial dysfunction. So any anti-inflammatory diet, any antioxidant diet is going to help recouple the NOS enzyme and lead to better production of nitric oxide in the lining of the blood vessel. And then also, if we can now focus on the oral microbiome and improve the diversity and start repopulating these really, really critical commensal non-pathogenic bacteria in the mouth, we can improve nitric oxide production through that way. And we know we can do that through diet and just the elimination of things like fluoride and antiseptic mouthwash. So yeah, there is a common mechanism of all these different seemingly unrelated and kind of extreme dietary patterns. But I think the mechanism is reducing oxidative stress and inflammation, which now allows for the body to produce nitric oxide, which then, by the way, is going to further reduce inflammation, oxidative stress, and immune dysfunction and get to the root cause of most, if not all, chronic disease.
Yeah, it's amazing that the role of nitric oxide in chronic diseases, it's like a silent undercurrent that influences the course of these conditions. And from hypertension, heart disease, diabetes, the deficiency of this molecule, can be a precursor to multiple health issues, making it, it should be a critical focus for preventative healthcare strategies. And I'm hoping, have you seen a move or a direction towards this? I haven't personally seen it in medical textbooks. What are you seeing in your academic life?
Well, I spent 20 years in academia. I taught in medical schools and trying to teach future physicians biochemistry and physiology and the molecular basis of cell signaling. And so it's a fleeting subject. It's not taught. It's not part of their vernacular. We tried to make those changes, but it's very resistant and very difficult to make changes to the American Medical Association and the way they train physicians. But I am seeing a movement, thankful to physicians like you who recognize this and help us get the word out. But, we know it takes on average 17 years for new science to become standard of care or introduced into clinical practice. And I think there's good reason. It has to stand the test of time and make sure that it's not only safe, but efficacious and has some clinical utility. But there are a number of docs now that are starting to integrate nitric oxide into their practice because your body cannot and will not heal without restoring the production of nitric oxide. And I think most physicians who practice Western allopathic medicine today realize that patients aren't getting better. We are not leading to a healthier American population despite spending more money per capita than any other industrialized nation in the world. Yet we have the sickest people. So drugs aren't the answer. We have to get back to the root cause of biochemistry and physiology, understand the mechanism of disease to the extent that we can fix it. And so we understand that in the nitric oxide field. There are certainly many other conditions that physicians have to address and fix. But here's what I do feel confident in. That nothing else is going to work until we focus on and restore the production of nitric oxide. It's not a silver bullet. It's not an end-all, be-all, cure-all. But what it is, it's foundational. And so drug therapy is not the answer. We have to get back and give the body what it needs, remove from the body what it doesn't need, and the body heals itself. That's how we're designed. That's how we're made. We're regenerative by nature. We just got to get out of the way.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.